You have an early phase and a late phase. So let's first talk about the early phase. All right. So this phase lasts for 1 to 2 days. All right. 1 to 2 days. So what happens here? As soon as you have a cut, all right, you know that it's an open wound. Bacteria can enter and it can cause infection. So what is the first thing the body is going to do? It's going to try and defend that area. So what will it do? It will start getting neutrophils in. All right. So you're going to have neutrophils. So neutrophils will prevent any fresh infection. All right. So this is the predominant cell. All right. So this has been asked as a question in your exam. Which is the predominant cell in the inflammatory phase? That is the neutrophil. All right. So next comes the late phase. Now what happens in the late phase? This is from 2nd to 3rd day. So neutrophil has come, that's finished its job. Next you're going to have monocytes which come in. All right. Now these monocytes eventually differentiate into macrophages. Okay. So what do these macrophages do? So we spoke about you having a wound and neutrophils will prevent any further infection. What about the contamination or the devitalized tissue which has happened there in that particular area because of that incident? Neutrophils will prevent further. What about at that point of time? That is what the macrophages do. These cause phagocytosis. That means it eats up all the dead cells by secreting certain proteases and it clears it off. All right. So you're going to have phagocytosis. All right. Now please understand, so far we have spoken about how to prevent infection and how to take out dead tissue. And we know that all these immune cells, they trigger the inflammation. All right. So they secrete inflammatory cytokines. So what happens at that point of time? These give you your classical feature. All right. Of rubor, Calor, dollar and tumor. These are your classical phases or signs of inflammation. And this is seen in the inflammatory phase. Okay. Next, moving on from this, you're going to have the phase of proliferation. In the phase of proliferation, what is going to happen? You have a big wound, correct? Now the infection and the dead tissues have been taken off. Now this has to fill up. So how will this fill up? This fills up by fibroblasts. All right. So it fills up the wound. So just filling up the wound is not enough. You need the wound to close, right? So eventually these fibroblasts will become myofibroblasts, a few of them, that will help contract and pull the edges of the wound together. All right. So that is the job of the myofibroblast. It pulls the ends together. Apart from this, the characteristic feature of this particular phase is the deposition of collagen. All right. You're going to have deposition of collagen. Now they'll ask you, what type of collagen is deposited? And the answer is type 3. Okay. The answer is a type 3 collagen which is deposited in the phase of proliferation. Okay. Now the next question is, what are the types of collagen? You need to know this. What you are concerned with this is type 1 and type 3. Okay. So in phase of proliferation, it is type 3 which is secreted. So next we have the phase of remodeling. All right. So far we spoke about the first 3 phases. So what has happened? All the building blocks have been laid in place. You have a wound cover which has happened so far because of the collagen and the underlying fibroblasts and all. Now this has to get remodeled. All right. So this is the final product. So till now you only have a rough product. The final product, the designing happens at this phase, and this is called as a phase of remodeling. Okay. So as we discussed in the first slide, this lasts for as long as up to 1 year. All right. So it starts from 2 to 4 weeks and it can prolong for as long as 1 year. So we spoke about the collagen, correct? So the major collagen which is deposited in the previous phase is type 3. Okay. But which is the strongest type of collagen? The answer is type 1. All right. The strongest type of collagen is type 1. All right. So this has been asked as a question, which is the strongest type of collagen? It is type 1. So now we are telling you that it is going into the phase of remodeling. So now you need to have something which is really strong because you're looking at long term. You're not looking at the short term at that point of time. So for long term, what's going to happen? All these type 3 collagens will start getting converted to type 1 collagen. Okay. So the question which they've asked in the exam is, what is this ratio between type 1 and type 3? All right. Type 1 is to type 3. The ratio is 4:1. All right. The other way of asking you this question is, what in terms of percentage? So if they ask you in terms of percentage, it is going to be 80:20%. So that means all the type 3 collagen or majority of it will get converted or replaced by type 1 collagen, which is a stronger type of collagen. All right. The next question they'll ask you is, what is the wound strength, or what is the maximum amount of wound strength which can be gained by that particular scar? All right. So first thing you need to understand is, let's take an example of a mirror or a glass. Once you crack it, no matter how many times you try and plaster it, it will never come back to normal. All right, that you need to understand. So the same thing applies with skin as well. You can only aim to attain a particular point, but not beyond that. So what is that point, or what is the maximum tensile strength it can attain? The answer is 80% of normal skin, and this is seen at the end of 12 weeks. All right, this is seen at the end of 12 weeks. Again, this has been asked in your exam and you need to remember this. Okay. So far we have understood the various phases of wound healing. All right, now we need to try and concentrate on the final outcome, how good the scar looks, and that depends on two factors. One is epithelialization, second is fibroblast reaction. So what you need to know is that whenever the epithelialization is maximum, the scar is better. Okay, and the same thing with respect to fibroblast. More is a fibroblastic reaction, worse is the scar. Okay, epithelialization means just from there only the epithelium jumping from one end to the other end, whereas if there is a lot of fibroblastic reaction going on underneath, then you have a lot of fibroblast reaction which pulls the wound together because of the action of the myofibroblast like we discussed, and the epithelial cell jumps in the end. All right, so this is the fibroblastic reaction. So more is a fibroblastic reaction, worse is the scar. If it's only epithelialization, the scar is that much more better. Now let's understand the types of wound healing. First one is healing by primary intention. So where is this seen? Commonly in our OTs. All right, I have done a laparotomy. I've put a big midline incision. I go inside. I either do a right hemicolectomy, a cholecystectomy, or an appendicectomy, whatever the surgery is inside. Then I close everything and I suture the skin back. The edges are opposed. So what did we say? When the edges are opposed, the only thing that needs to happen is epithelialization. Correct? All right. So this is maximum, and what happens to the fibrosis or the fibroblastic reaction? Very less.